Recent high-profile cases have raised the question of just why breast cancer is so prevalent among Māori women. One breast cancer survivor is dedicating her life to the cause, and she's the only Māori breast cancer surgeon. I caught up with Dr. Maxine Ronald of Ngāpuhi and Ngāti Wai at the Breast Cancer Clinic in Whāngarei Hospital. E te tākata tēnā koe. Thank you very much for your time and for talking to us. You've been awarded $300,000 to boost breast cancer research. Why do you think there is such a stark difference in survival rates between wāhine Māori and non-Māori women with breast cancer?
I think it's complex, it's multifactorial why Māori have worse outcomes than non-Māori. We have a higher incidence, but that's not necessarily related to genetic factors. We're not genetically predisposed to do worse from breast cancer. So we know lots about the breast cancer pathway for Māori already, and we know lots about what we could do. Some of the issues is implementing that. So for example, we know that if Māori women are diagnosed through the breast screening program, they will do as well as non-Māori women who are diagnosed through the breast cancer program. And that's partly to do with early detection, but also because the breast cancer program has a really tight kind of protocols and things around the timeliness of investigations and treatment. If women are diagnosed through what we call the symptomatic pathway, so they detect a breast lump, those kind of processes don't exist. And so what we see for women who are diagnosed through that pathway is that the equity really kind of gap really starts to widen.
That's where there's a big change.
Yeah.
Why is that the case, do you think?
A lot of it is to do with stage of presentation. Okay, so the earlier breast cancer is detected, the better people do. And I think that's a really important message, is that breast cancer is very common. 1 in 9 women will get breast cancer, but it's very treatable and very curable if we can detect it early enough. And so that's a really important message for wāhine and for whānau to understand. The later it's detected, the harder it is to manage, yeah. So one of those reasons is late detection. That's why enrolment and engagement in the breast screening program and self-examinations and all of those kind of things are really important. But then there's all these system factors which kind of compound all of that.
So I want to talk about the system factors. What are the system factors that are inhibiting a rate of success and therefore declining the rate of death by breast cancer for Māori women?
Some of them are to do with timeliness. So we know that Māori women are less likely to receive their surgery in the same time frame as non-Māori women. And that kind of seems hard to understand, but there's a whole lot of stuff that kind of goes along with kind of institutional racism, you know, all those kind of systemic barriers that even once people are in the pathway, that kind of pathway is delayed and prolonged.
Why is that such a factor? Because I'm sure you would have heard the counter-arguments from people about this as well. Why is this such an issue, Doctor?
So it's an issue because like, when you look at, say, bowel cancer, for example, we know that you can account for about 2/3 of the reasons why Māori might be delayed through or have worse outcomes. And then there's like about 1/3 where it's hard to explain, and a lot of that is to do with access. And when you talk to Māori about their experiences of the system and they talk about their experiences of racism and difficulty accessing services from a multitude of reasons, then that tells us what we need to know about how the system functions for Māori.
And are we talking about just experience, or are we also talking about treatment and the process of treatment as well?
Well, there's also evidence that Māori are less likely to receive the same quality of treatment as non-Māori. And when we talk about quality, we're talking about timeliness to treatment, but also the treatment that they're offered. That may be surgery, but then there's other treatment as well, like chemotherapy and radiotherapy. And so how much of that Māori get compared to non-Māori is important, yeah.
So when a government says that they want, for example, in this particular situation, they want to treat all New Zealanders equally, part of which I think the general public probably thinks, yeah, that sounds about right to me. Equal access, equal opportunity, equal treatment. That is not the same thing that you are talking about. What do you say to the argument to people who would agree with the government and say equal access and equal opportunity should therefore get the same kind of outcome?
I mean, it sounds lovely. At the heart of that, it's when people conflate different treatment with special treatment. And it's not the same because people start at different points. And, we're talking about Māori, but we could equally be talking about tangata whaikaha with people with disabilities. We could be talking about people in rural settings. And so for people to have the same outcome, different people will need different interventions. And it's not special treatment, it's just what is required for this person here to have the same outcome as this person over here, or to have, the optimal health outcome.
Do you have any concerns? For example, the New Zealand Health Strategy talked about achieving a shift in thinking, previously focused on to achieve health equity, now talks more about access. Y2575 recommendations in response from the Crown doesn't talk about equity, again talks about access. Do you have any particular concerns when the government does a subtle shift and change in language, the likes of which we are seeing now?
I think it's really dangerous.
Why is that?
Because it's diluting the principles of Te Tiriti, it's diluting the contract that this country was founded on, but also I think really critically it misses the solution. So the solution to Māori health inequities lies within Māori communities. There's so much knowledge within our communities, and that's a real skill and an area of expertise. We know that in Te Kaha, that's a nearly 90% Māori community, they had only a 45% breast screen coverage, but they got into their communities, they asked them why that was happening and implemented what the communities recommended. They got their breast screening coverage up to 98%. So that's huge, and so we really need to value that. But if we're diluting the message down, if we're not focusing on equity for Māori, then we're going to miss the solution.
Should more community groups, should iwi be diving more into this space, do you think? Or will this potentially be something you might look at as a part of the research?
I think it's essential. We already know that communities where we're able to empower our Māori health providers to get in and really reach out into communities to encourage whānau to engage with health services, they do really well because they've already got that trust there, and they can make the calls, they can go and ring people up, they know where someone's going to be. So that's really key, but that has to be resourced. We've got to really make a transformational change.
You mentioned the treaty earlier, and again there'll be audience members who will sit there going, here we go again, we're talking about the treaty. Why is that so important? It's
because our tupuna had an imagination. They had a vision for us, and they signed the Te Tiriti based on their aspirations for us, their mokopuna. And the Crown is not keeping up their side of that contract, which essentially allowed settlers to come to New Zealand. So I just can't understand how Māori, who were equal partners at that stage, are now second-class citizens in our own country. We have the worst health statistics across almost every, like we're talking about breast cancer now, but it's across almost every area of health.
The research award funding that you were given is for 3 years. After 3 years, will Aotearoa have a plan from Dr. Maxine Ronald that says this is what we need to do, fund it and get it going, and we will save lives? Is that the objective? Is that what you will achieve after the end of this 3-year research period?
Well, that's what I want to achieve. And I think I have an idea already about what we need to do, and it's not just about Maxine Ronald. There's some amazing, research groups out there. There's amazing people in the community who are doing awesome work. The difficulty is translating that research that they're doing into a clinical and a community context. So, we know already about the breast screening pathway that I talked about. We need to implement, I think, that into the symptomatic pathway. That's a pretty easy shift, but that needs resourcing. That alone isn't going to do it. We need to be looking at early detection and screening, and then we need to be looking at survival as well. Like when people have had all their treatment, their initial treatment, what's happening after that to keep them well.
And you said that resource is the word that always comes up, and funding is crucial. Do you honestly believe that, given the current political climate, that will happen?
With this current government, I am very sceptical about that. I'm very concerned about some of the things that I'm seeing coming out of the ministry. I feel like they're really diluting down the significance and the importance of Te Tiriti. They're reducing the significance of using, equity as a key performance indicator, and that worries me. I think it's really dangerous.
Do you think that might have been less of a concern if we still had, for example, Te Waka Whai Ora, a Māori health authority?
Well, I mean, at the heart of this, what we're talking about, because we're talking about communities and we're talking about the importance and the value of that, that's at the heart of it what Te Waka Whai Ora was all about. So I think that's been a real mamae, a real pōuri for all of us, not just those working in health, but for all Māori really, and for non-Māori who could see that this was a way forward. Yeah. It wasn't perfect, but why do Māori always have to have, get everything right the first time when the Crown has been getting it wrong for, 180 years?
We're here in your clinic, so we need to let you get back to May.
Kia ora.
So thank you for taking the time with us. Ngā mihi, Rika.
Ngā mihi.